This is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. Operatives of the National Drug Law Enforcement Agency reportedly broke in on some young women and arrested them for organizing a cannabis party in the Asokoro area of the Federal Capital Territory. It is gathered that the youth were having a nice time when the NDLEA officers invaded the venue of the party. According to a report, at least 20 inmates have died of pulmonary tuberculosis and about 100 suffered the infection in the old Katsina custodial center. Reliable sources who spoke with newsmen described the incident as an effect of corruption and a shockingly poor state of hygiene and health services in the 104-year-old facility. The source alleged that some senior officials, including those in charge of the facility in Katsina, have attempted a cover-up to avoid accountability. It was gathered that the officials who should know about the ugly development as a result of their role, which involves receiving reports on such development, were kept in the dark. The prison, constructed in 1918 by the British, has an installed capacity of 300 inmates, but currently holds about 900. And President Muhammadu Buhari on Wednesday in Abuja likened Nigeria's increasing capacity for production of COVID-19 vaccines and other medical supplies to not just a matter of urgency, but of national security. The president consequently gave directive to the Minister of Health, Dr. Osage Hanire, to submit a progress report by the end of May 2022 on the indigenous production of vaccines. A new study has shown that people who have a history of asthma or allergies may be at higher risk of developing high blood pressure and coronary heart diseases. The study, conducted by a group of researchers in China, used a 2012 data from the National Health Interview Survey, which included over 10,000 adults who had asthma or at least one allergic disorder, such as a respiratory, food, or skin allergy. The lead author of the study, a postdoctoral researcher at Peking University Chuzhen Hospital in China, Yanggu, said in a statement that the research has further stressed the need to pay better attention to the blood pressure of patients with allergic disorders. Kogi State Government confirmed 41 cases of Lassa fever with 7 deaths in the state within 4 months. A statement issued by the Permanent Secretary, Ministry of Health, Olonge Daniel, which was made available to journalists in Lokoja on Thursday, stated that 9 local government areas, namely Ida, Ibaji, Lokoja, Ajaokuta, Ofu, Okene, Okehi, Kaba, and Adavi had reported at least 1 confirmed case during the period. Olonge noted that the ministry had responded appropriately and timely to the epidemic through the release of funds by Governor Yahaya Bello to curb the outbreak. This is TOS Television Network and you're watching Health 54. More intriguing reports after this time out. Stay with us. Welcome back. The World Health Organization said on Friday that it strongly recommends a Pfizer COVID-19 antiviral pill Paxlovid for patients with milder forms of the disease who were still at a high risk of hospitalization. However, the United Nations agency warned it was extremely concerned that the inequality in access seen with COVID-19 vaccines would again leave low and middle-income countries pitched to the end of the queue. U.S. pharma giant Pfizer's combination of nirmatrelvir and ritonavir was the superior choice of treatment for unvaccinated elderly or immunocompromised people with COVID-19, the WHO's expert said in the BMJ Medical Journal. As part of efforts towards making medications affordable and accessible in Africa, TytoCare has announced its partnership with Pharma, a technology-driven healthcare company building Africa's largest health management organization. A recent statement issued by the companies indicates that the partnership involves the integration of the TytoCare solution into Pharma's telehealth offerings, which enables pharmacies to provide patients with enhanced remote care through in-depth physical examinations, Both companies said the partnership will improve healthcare services to patients in Africa. A team of scientists in the United Kingdom who reportedly undertook a huge ecological dig of cancer analyzing the complete genetic makeup or whole genome sequence of tumors from about 12,000 patients have said the unprecedented amount of data allowed them to uncover new patterns in the DNA of cancer, hinting at causes that are not yet understood. They add that the genetic clues will ultimately help improve diagnosis and treatment. Cancer can be thought of as a corrupted version of our own healthy cells. Mutations to our DNA change our cells until eventually they grow and divide uncontrollably. Traditionally, many cancers have been categorized by doctors based on where they are in the body and the type of cells involved. But whole genome sequencing can provide another layer of key information. Resident doctors at the Jos University Teaching Hospital Plateau on Thursday lamented the level of insecurity in Nigeria, saying that the situation was affecting the performance of their members. The resident doctors who expressed concern over the lingering situation disclosed that in the past 3 weeks, 2 of their members were abducted. The doctors marched through the street and threatened that they could not guarantee uninterrupted service delivery by their members if nothing was done to address the problem. A federal judge in Florida has struck down the Biden administration's mask mandate for airplanes and other forms of public transit, calling it unlawful. U.S. District Judge Catherine Kimball said the National Public Health Agency had exceeded its legal powers in issuing the mandate. The U.S. Transit Authority said it would now no longer enforce mask wearing. U.S. Centers for Disease Control and Prevention has last week extended the mandate until May 3rd. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS TV Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS TV Network. Remember, health is wealth. So till I come your way again, just stay healthy. I am Rose Audu, and many thanks for watching.